The eyes are often described as windows to the soul, but they can also reveal important clues about our overall health. Subtle changes or symptoms in the eyes may sometimes signal underlying problems within the brain, such as increased pressure. These early warning signs can be easy to overlook, yet they play a crucial role in identifying serious conditions before they progress. Recognizing these subtle indicators allows for timely intervention and can help prevent more severe complications. Understanding the connection between eye symptoms and brain health underscores the importance of regular eye examinations and prompt attention to any unusual changes. Eye pressure spikes refer to sudden increases in the pressure inside the eye, also known as intraocular pressure. These spikes can occur for various reasons, such as eye injuries, certain medications, or underlying health conditions like glaucoma. Other common causes include inflammation, blocked drainage channels, or even excessive fluid production within the eye. Eye pressure is typically measured using a test called tonometry, which assesses the force exerted by the fluid inside the eye. Regular monitoring of eye pressure is important, as significant spikes can lead to optic nerve damage if left untreated. Understanding the causes and methods of measurement helps in early detection and management of potential eye health issues. Intracranial pressure refers to the pressure within the skull, which is exerted by the brain tissue, blood, and cerebrospinal fluid. Maintaining a stable intracranial pressure is essential for proper brain function and overall brain health. If this pressure rises too high or drops too low, it can disrupt the delicate balance needed for the brain to operate efficiently. The body regulates intracranial pressure through several mechanisms, including the production and absorption of cerebrospinal fluid, as well as the dilation and constriction of blood vessels within the brain. These processes help ensure that the brain receives adequate oxygen and nutrients while preventing damage from excessive pressure. Proper regulation of intracranial pressure is crucial, as imbalances can lead to serious neurological complications. The eye and the brain are intricately connected, both anatomically and physiologically. One of the key links is the optic nerve, which transmits visual information from the retina to the brain. Surrounding the optic nerve is a sheath filled with cerebrospinal fluid, the same fluid that cushions the brain and spinal cord. Changes in brain pressure can influence the pressure within this sheath, which in turn may affect the pressure inside the eye, known as intraocular pressure. This relationship means that alterations in cerebrospinal fluid dynamics can sometimes be detected through changes in the optic nerve or the appearance of the eye. Understanding these pathways helps clinicians assess and manage conditions that involve abnormal pressure in either the eye or the brain. Scientific research has increasingly focused on the connection between eye pressure, known as intraocular pressure, and brain pressure, or intracranial pressure. Several studies have explored whether sudden spikes in eye pressure can influence or be influenced by changes in brain pressure. Medical evidence suggests that while the two pressures are regulated independently, there are circumstances where alterations in one can affect the other, particularly in certain neurological or ophthalmic conditions. For example, researchers have observed that significant increases in intracranial pressure can sometimes lead to elevated eye pressure, potentially impacting vision. Conversely, abrupt changes in eye pressure may serve as indirect indicators of underlying brain pressure abnormalities. However, the exact mechanisms linking these two systems remain an active area of investigation, with ongoing studies aiming to clarify their complex relationship. Understanding this interplay is essential for improving diagnosis and treatment strategies for both eye and brain disorders. Recognizing early warning signs of abnormal pressure in the eyes or brain is crucial for timely intervention. Common symptoms may include persistent headaches, sudden changes in vision, nausea, or episodes of vomiting without an obvious cause. Some individuals might notice double vision, a loss of peripheral vision, or a sensation of pressure behind the eyes. In more severe cases, confusion, difficulty with balance, or even brief episodes of vision loss can occur. These signs should never be ignored, as they may indicate serious underlying conditions such as glaucoma or increased intracranial pressure. Prompt medical evaluation can help prevent permanent damage and improve outcomes. Early detection is key to addressing the root cause and protecting both vision and overall health. Healthcare professionals use a variety of diagnostic methods to evaluate both eye and brain pressure. For eye pressure, a common test is tonometry, which measures the pressure inside the eye and helps detect conditions like glaucoma. To assess brain pressure, doctors may use imaging techniques such as CT scans or MRI, which provide detailed pictures of the brain and can reveal swelling or other abnormalities. In some cases, a lumbar puncture, also known as a spinal tap, is performed to directly measure the pressure of cerebrospinal fluid. These diagnostic tools are essential for identifying underlying issues and guiding appropriate treatment strategies. Maintaining healthy eye and brain pressure levels involves a combination of preventive strategies and lifestyle choices. Regular eye exams can help detect early signs of pressure changes, allowing for timely intervention. Staying physically active, eating a balanced diet rich in fruits and vegetables, and managing chronic conditions like hypertension and diabetes all contribute to overall eye and brain health. Avoiding smoking and limiting alcohol intake can also reduce risk factors. It's important to manage stress effectively, as high stress levels can impact both eye and brain pressure. Lastly, following your healthcare provider's recommendations and taking prescribed medications as directed are essential steps in prevention. Staying informed is essential for safeguarding both your vision and cognitive health. By understanding the signs and symptoms of potential issues, you can take proactive steps to address concerns early. Regular monitoring of your health and prompt attention to any changes can make a significant difference in outcomes. If you notice unusual symptoms or have concerns about your eyesight or mental clarity, consulting a medical professional is always the best course of action. Prioritizing your well-being today helps ensure a healthier, brighter future.